Welcome to the Anatomy of Therapy. I'm Dr. John Cebulski, back with Dr. Nick Askey. Nick, how you doing, brother?
I'm above the dirt, man. Like
How are
we're
you
we're
doing?
good.
How you doing with this Packers season? I know you're a
Uh
diehard cheesehead.
I have confidence that we'll turn it around. It's just been frustrating. Like
Yeah.
our coach is playing Fruit Ninja instead of drawing up plays, but we'll figure it out.
You got some talent. You got some talent. I mean, I'm a Texans fan, so I don't have much to say. But let's get into it. We would always love to hear your comments about the episode, what you would like to hear, any injuries, any topics that you are concerned. We always look for the comments. We always read them. So any comments you guys have, you're welcome to. And Nick is practicing, by the way, in San Antonio. His schedule's full, so good luck getting in to see him. But if you're in San Antonio, the greater San Antonio area, 12 out of 10 would recommend, but good luck getting in to see him. Um, oh, dude, I met with Tony Tran actually this week, and I don't know, we'll see what happens. So if you're in the Houston area, maybe come to hang out with John. But let's get into the posts. I want to start out with some humor. Um, but it is medical related, but okay. So I'm gonna stop it there. She goes on. She keeps riffing for a little bit there, but as we've both been doctors for 15 plus years now, like, what are your thoughts on this one? Have you ever turned over the wheels of treatment to a patient and just been like, "What do you want me to treat?"
No. I just like I'm control freak level A. And I think that's why I'm busy because people are coming to me because their way didn't work. Um, and a lot of that is like people are looking for direction. And like my wife works in education and she's worked in some pretty rough schools. And a lot of these kids, even though they misbehave and they act out, they're opposition defiant, like they crave structure. They just have a creative way of showing it. And even patients that may kind of like kind of go out and choose their own adventure and like do their own thing and maybe not buy into your thing right away, um, that is a sign that you either need to communicate more effectively on the why and why it's necessary, why it's important, why it's critical, or the patient just doesn't totally trust you yet. And I tell patients, I'm like, I don't want you to blindly trust me. I want to earn it. Um, so I will dictate the care. And if we don't have compliance or they try to like get me to kind of switch to something when the other thing is still kind of smoldering and like something that if we leave it for 2 seconds, like the wind's going to blow and it's going to start back up. I'm like, we're going to be chasing our tail forever. And you haven't shown that you could do exercises for one body part. And I tell people, mo problems, mo exercises.
Dude, I mean, but here's the thing. I know that you're a leader of men and women and everything in between. But there are a lot of doctors like this, obviously. I mean, this is a psychologist. I can't speak for all psychologists, but there are a lot of pandering doctors. I don't know how long they last, it seems, but like the idea of just like making the person happy. There's also kind of a wave in doctors where, and I won't go as far to say like patient-led care, But like, I understand the idea of listening to your patients. And that's not what that is. That's allowing them to dictate care. Like, is she going to give them amphetamines or like sleep meds? Like, how is that going to be helpful? You know, I understand the idea that it's just an exacerbation of doctors who are like, you really need to take your patient's interests into care. And you're like, absolutely. Do a good history, do a good evaluation, hear where they're at and where they want to go. But you can't let them dictate care. It makes absolutely no sense to me. It's just, I think doctors need to grow a pair.
And there's a delicate balance between being empathetic and almost taking the Socratic method if you get opposition on your recommendations of like, all right, why? Like, does this not fit with your life? Do you have religious oppositions to this? Do you have like I'm reading a good book right now and I it's called The Soul of Care. Um it's on like the moral like the subtitle is the moral education of a husband and a doctor. Like the guy's an MD psychiatrist, and so he was on one side of the clinical table for 50 years in China and in the US. And so he sees the cultural differences between like Taiwan, China, US, and what they value and how they respond.
Yeah.
But but he's like only 25% of the patient care provided is done by the physician. 75% is done by the family and the caretakers and by the patient like following instructions at home. But he also his wife she got dementia. So he was on the other side of things. So he had perspective of being in the patient's shoes and being on the other side of the desk.
Yeah.
And he's like, all right, like we have this lack of empathy problem and lack of communication problem because I'm on the receiving end of it now.
Right.
Because I have to kind of be the wind talker for my wife because she has dementia. And these people don't understand all the behind the scenes stuff that comes with being a caretaker and like digging into all of that. But I think another modern problem we have is a lot of these like CMS, Medicare insurance carriers with big hospital groups, they do patient surveys on satisfaction. And if you piss off the patient because you're recommending something they don't want to do, they will give you a low score and that will affect reimbursement rates. You're going to get yelled at by the hospital administrator and the higher ups. So it's almost like what's happening with college football and college sports. Like
Yeah.
if you reprimand a kid, he's going to transfer.
Yeah.
So it's like the inmates are running the circus or
It's a day.
monkeys running the circus.
It's a slippery it's a slippery slope for sure. All right, let's talk about gym supplements. Yeah. Hold on, let's get over to it. Gym supplementados.
Just got back from a gnarly push day over at Fish Oil Fitness. Gonna someone I get to supplements with ACS. Nice to meet you. The staple of mine for any workouts involving overhead or subfemoral movements. Macroscopic lactate stimulants. Pick one a day. Proven to increase blood flow to your androgynous regions by 5%. Highly recommend 60 mil. That's extra.
That's nothing.
Muscular training, multiple. Toss them in the food processor until they come out of viscous paste. These ones guarantee a bench press of at least 245. What it works is the gamma receptors in each pill use echolocation to visualize your needs.
Some people would believe this, like
It's like a cheat code. I've been avoiding protein powder ever since the formidable fat burner firestorm back in '06. Then my buddy Paladin and I tracked down this alternative in the diuretic aisle called multitudinous macro massacre. Protein, but if it was on PEDs. I normally get my energy from the inferior performance. But if I need an extra boost, I'll take a dry scoop of this stuff. Rambunctious rhinoceros. So, yeah, it's on. It's, have a good lift.
Oh, dude. Okay, so Nick sent this one in this week. What besides being hilarious, why'd you send that one over?
So that guy, he just cracks me up
Yeah.
because outside of like that kind of stuff, like he basically makes fun of me. Like he makes fun of like people that like to trail run and be out in nature and like people that drive Subarus in Colorado and like people that buy stand-up paddle boards and like people that run marathons and ultra marathons. And but the point here is I was like, okay, there's only so far you can go down the supplement rabbit hole and fix a problem that your behavior created.
Oof. Damn. Quote that.
So, like a lot of people, they're like, "Oh, I'll just dust my ribs with Lipitor." Or, like, you're not like. There's a reason they call them supplements.
Right.
Like they're there to supplement good behaviors and habits. They're
Exactly.
not there to cover up bad habits. That's why they don't call them cover ups.
They're supplements.
Like,
Yeah. Yeah.
and like I get all these high school kids that they're ordering peptides from China off
Right.
of TikTok. And they're getting all these like pre workouts. And like I've had 3 kids have seizures this year
Jeez.
because they're taking these crazy pre workouts
Yeah.
with allergy medication, and they'll have a seizure right in the gym.
Gosh.
And they're like, and like I'm not a big guy, but like I'm relatively fit. So they'll like the parents will ask me questions and they're like, all right, what supplements? I'm like, all right, I'm pretty much a minimalist on supplements. Like
Yeah.
I take vitamin D, I take magnesium, I take creatine, collagen, and protein powder. And
Yeah.
I tell the parents, I'm like, creatine is not bad for your kids. Like it's good for cognitive health, blood sugar management, strength, performance under fatigue, which you show me one high school kid that's not tired 24 hours a day.
Totally.
And the likelihood of them cutting and rolling an ankle or cutting and correcting, and then they're going to perform a little better. Just got a bad rap during the Mark McGuire, Sammy Sosa days because they thought it was steroids and you were going to shut your kidneys down if you took one crystal of it.
Yeah.
But I'm like, if you want to be a minimalist, like get enough protein, and the most proven supplements all start with C: collagen, creatine, and caffeine.
God, I love
So,
caffeine. That's great. Yeah.
but it's
Yeah.
like sometimes you don't want to go that far down the rabbit hole. And like I get most of my supplements from companies that are NSF certified.
Right.
So you know you're getting what you're getting. And I recommend that with all my athletes because if you're ordering it from some back alley Timu store, you don't know if there's some fillers in there and you end up in a Barry Bonds situation of like, I didn't know there was like anabolic steroids in my Flintstones vitamins. Like I just took them.
Yeah.
Like
Yeah. Yeah.
that's not an excuse that's going to fly anymore.
Right.
So if you get something that's NSF certified for sport, you know it's not as rigorous as the FDA, but you at least have someone with no skin in the game, no financial interest in the company that's regulating it and measuring it and testing it.
Yeah. I mean, I completely agree. What I would say is like if you are listening to this right now, you're probably pretty into health and fitness. And if you've been into health and fitness to any degree for any amount of time, you've probably gone down a little bit of a rabbit hole of supplementation. You've probably been had some kind of goal like you want to run some insane trail run. God, I don't know, like 100+ miles. I don't know who would freaking do that, but
Dumb people.
idiots. Congratulations. But what is it, 4 or 5 now? How many are you up to now?
9.
God, dude, I fell asleep for it. That's insane. But whatever, if you've had some sort of athletic goal in your life and you've gone on a regimented training sort of program, or you've been part of a team and you wanted to win and do well in a season, and you've gone on a training or preseason kind of run, you've probably looked into, supplementation. You're like, all right, I want to step it up. I want to do something better. And I've gone down the rabbit hole myself. I've tried red velvet deer antler, whatever. Like I've given some, and honestly, I landed with you. Like I think my favorite, right, like is fish oil. This I protein powder, caffeine. I've never really enjoyed the collagen, but it's great. I've never heard anybody not say anything bad about it. I've just never gone down that rabbit hole. But like fish oil, caffeine, protein powder, like the series, like the level, the normal stuff. Other stuff, I had some vitamin D for a little while. You know, I get some vitamin C if I'm feeling sick and maybe some zinc, but like nothing crazy. Like it doesn't really move the needle, honestly. So like whenever you, if ever you do hear some of these supplements making kind of crazy claims, some flags should go up. Just know that it goes back to what we said before, what Nick actually said. What was the quote? Like, you know, supplements don't cover up bad behaviors. Like it's far
Yeah,
more about what you do on a day-to-day basis than the little pills you're going to swallow a couple times a day.
and I look at it too. It's like, all right, do I want to spend a ton of money on this supplement when I could really work on my sleep for free and probably get more of a benefit? And believe me, like you know me, John. You know I've tried like I've made and compounded my own nootropic stacks.
Same. Yeah.
Like I've researched like okay, like these compounds like require more choline, and if I don't want to eat 10 eggs a day, I'm going to get some powdered choline and I'm going to put that in the capsule and I'm going to mix it up. And like, I've freaking Walter Whited some supplements, like
Same.
not blue
Same.
rock candy, but
Yeah.
it's like I've tinkered with all of them. But to rob a quote from Rob Wolf himself, like if you do an intervention or take a supplement and it doesn't change how you look, feel, or perform, ditch it.
You got to be honest with yourself. Like some people are like, I don't know if I can feel it. You'll know if you can feel it or not. Like, you know, sometimes it does take a little bit of time to build up in your body, but like either you know or you don't. Just be honest with yourself. Okay, so now I want to dig into a little bit of industry lore. We're gonna start it here with Nick's post, and then it's gonna get a little bit dicey. So stick around. Okay, here we go.
Jerry.
Okay, here we go.
About one of the most painful and frustrating conditions that I see in clinic, and that is the dreaded frozen shoulder.
So annoying.
This miserable, horrible pathology causes people severe, constant pain and global disability for many years. And despite over 40 years of research and clinical trials, there are just no good, effective treatments for it. And that's because, according to this recent paper just published, frozen shoulder is not just an isolated musculoskeletal pathology. It's a manifestation of systemic metabolic, endocrine, inflammatory, vascular, and immunological dysfunction.
Yep.
In other words, the frozen shoulder is the symptom of multiple underlying issues, often hidden deeper in your patient's histories and lifestyles. Things like thyroid dysfunction and estrogen signaling failure in the peri and postmenopausal ladies. Poor diet, smoking, sleep disruption, sedentary habits, and psychological distress driving chronic low-grade systemic inflammation. It's these factors why 10, 20, or 30 minutes of manual therapy or stretching often does fuck all to help a frozen shoulder. And so we need to start looking at the management of frozen shoulder completely differently. And so here's how I think we should start managing somebody with a suspected frozen shoulder. First things first, get them checked for any signs of thyroid dysfunction, hormonal imbalance, or insulin resistance. Next, check their sleep-wake cycles, their diet, smoking, and alcohol consumption levels. Then ask them about their stress and activity levels and advise and encourage more movement and to avoid prolonged inactivity. And then focus on your active and assisted joint stretching and manual therapy for that little bit of pain relief, and build up graded activity, and of course throw in some resistance-based exercises at a level that they can tolerate.
And remember that this isn't a solo game. Get other healthcare professionals involved. You might need to get a GP, an endocrinologist, a nutritionist, and maybe even a psychologist to see your patients. If you stack all of this together, now you're treating the pathology in the person, not just their shoulder. So as a physio or a patient, ask about the bigger questions around health and lifestyle. Think system, not just joint. Frozen shoulders are
So the great and wonderful Meekins has spoken.
And he actually endorsed manual therapy for something.
My gosh. That's
I don't
how you
know.
know it's bad. That's how you know it's frozen shoulder is one of the most inconsistent things to fix. I've seen people with frozen shoulder and their pain goes away in 3 visits. I've seen people with frozen shoulder and I'm like, this is never going to end. This is never going to end. Go, sorry, I cut
Yeah,
you
and
off.
like the fact that Meekins endorsed manual therapy, I'm like, all the astrology people will be like, you got to prolapse Uranus or like a retrograde something. Like, what is going on here?
Yeah.
But um, but this is something that I like. I agree with bits and pieces of what he says,
Yeah.
but I agree with the vast majority of what he said here because frozen shoulder it's 8 times more common in females because there's a huge hormonal component.
Right.
Like if I get a woman with non-traumatic shoulder pain, 40 to 65, like it's frozen shoulder until it's not.
Yeah.
And because only 5% of frozen shoulder is traumatic. And so if you get someone with thyroid disorder, diabetes, they're perimenopausal, like I tell patients, I'm like, this is the closest thing I can tell you as a provider that you have cancer without telling you have cancer because it's going to be a long road.
Yeah.
I tell people like it's a 1 to 3 year prognosis once it's locked up of it thawing. And I'm like, all right, so we have a 1 to 3 year flood. I can't stop it from raining, but I can give you some rain boots, some rain gear, and an umbrella to make it a little bit more tolerable to weather the storm.
Exactly.
Like you can't expect more of me than that. And if you do, you can hunt for somebody else, but you're not going to find it. So the research shows if you get an injection in the shoulder in the first 3 to 4 months, it can improve the outcomes. With people with thyroid disorder, there is some research that I've been discussing with the shoulder ortho I work with here in town that she was kind of unaware of, that they're doing trials with intranasal calcitonin, like a nasal spray.
Interesting.
And it's because people with thyroid disorder, that's right next to the parathyroid gland, which affects the calcitonin levels. And that can improve their symptoms and increase like their satisfaction and decrease their time to resolution.
Huh.
But frozen shoulder is different because I tell people, I'm like, this makes us look like morons.
Yeah.
Because we don't know what causes it. It's multifactorial. I've seen it happen after like vaccines in the shoulder. It's been put on the list for long COVID complications. When they were rolling out the vaccine in the early stages of COVID, I had like 11 patients in 1 week that had frozen shoulder in the arm they didn't get the vaccine in.
Whoa, that's weird.
And then they published a study that was very common. Like 2 months later, you can get it up after an upper respiratory infection. Yeah. Like I had one 19-year-old boy that had it in both shoulders at the same time. But he had eczema issues. So we obviously know there's an autoimmune component with him. And like I had to treat him like sitting down the whole time because he couldn't lay down on the table because he couldn't get up.
Yeah.
Like when both of them are locked up.
Dang.
But it's a very frustrating condition. And I do agree with Meekins that you got to manage the whole health of the patient. If you get a patient that their primary is non-existent or it's an urgent care, I'm like, hey, you probably have some metabolic and endocrine dysfunction. You need to get a primary doctor. If you don't have one, I will recommend a good qualified one, because if you haven't had blood work in 5 years, this is your check engine light that there's something going on that's probably going to have more significant negative effects on your health than your shoulder not moving. So we need to act on this like quickly and address this. And this could be the thing that kind of turns the corner and kind of pops you in the forehead to actually change your habits.
100%. It is so annoying. I have a patient, it was a couple months ago, but she was great and I could get her relief. She would like, I mean, and we talked about all this stuff. Like she would feel good for 2 or 3 days after the visit, and then she'd be like, it all came back. But she had tried different places and no place could get her that 3 or 4 days of relief. So she was happy to come to me. And same thing. She was like mid 50s, like perfect demographic for this. And I was like, and she had just had frozen shoulder on the left, like the previous year. And she had gotten over it, but she was like, yeah, that was just like, almost a year until I got over it. Then it just went away. And I was like, listen, I went through that. I told her, like, this is going to be a ride. Like, if you want to come and get some relief, then great. But, like, I'm not telling you that I'm going to fix this today. I will say the blood stuff is amazing. And I'm not trying to shill out, but I just did connected with a company called 100 Health. I'll put the link below. And they do this, like, personalized 108 biomarkers sent to your phone. You get it all personalized. You go get the blood draw. They send you all the information. AI does all this wonderful stuff. It's actually really convenient. If you don't have a good primary doctor, and honestly, sometimes primary doctors aren't great at everything. If you have a primary doctor you trust, do that. If you don't know who to have, 100 Health is a fantastic company. Check them out. But yeah, things like this are definitely more complicated, and stop throwing darts at, blindfolded, and start making like educated guesses based on blood work, based on finding out what's going on inside of you, and then make moves. I think that's the best you can do.
Yeah. And if you have a female patient, I think their OB is a better equipped physician to deal with hormone issues than their GP,
Mm,
unless they're going to like a functional medicine or concierge doctor.
right.
And like all my female patients that don't have a good primary and they're not really jiving with their OB, I'm like, all right, my my primary care doctor is a female PA. I'm like, you kind of need a female doctor if you're going through this
Yeah.
to have the empathy and understanding that female hormones are like freaking Mexican jumping beans where guys are just like pinto beans laying on the trampoline.
Yeah.
Like ours are pretty like they just kind of slowly decline. Where I was like menopause is like puberty 2.0. Like it's like the hormone storm, only secondary to puberty, and then third place is like postpartum.
Brutal. Brutal. Okay, so now we're going to dig a little deeper into some industry lore. There's a conflict that's been brewing for many years. And if you aren't, I don't want to say if you aren't in the industry, you wouldn't understand. I hope you don't understand. It is a waste of breath for 99% of the world to know. But there are some nuances, I think, that this controversy can help uncover for the common man, woman, about how your body works. Okay. Because there's kind of these two fields, and both of these guys are kind of extreme on either side of the field. But let's watch the clip, and we'll explain it to you more here in a second. But here we go.
So I'm sure many of you have seen and heard the self-proclaimed biomechanical geniuses over at Functional Patterns going on about how back squats and deadlifts destroy your ability to run faster and better, and how that they think there is no evidence that back squats or deadlifts can actually make people run faster or better. Well, actually, there is. This very well-designed 10-month-long study looked at elite level soccer players aged 17 and 18 who are training 4 to 5 times a week already. They then split them into 4 groups and asked 3 of them to do 2 extra training sessions a week on top of their usual soccer training. The first group did traditional strength training, so things like
That is not
squat and
Ronaldo.
deadlifts for 5 sets of 10 reps each. The second group did plyometric and sprint training, like 10 to 30 meter dashes and drop and countermeasure jumps
That's
for
Ronaldo.
6 to 8 reps. And then the third group did functional training. So basically
What
flapping
the-
around like with some mini bands and sling suspension devices. And then the last group did like the control group and just did their usual 4 to 5 sessions of football training with nothing extra.
It's a great study.
After 10 months, they tested all of these lads 1 rep max back squats, their standing jump heights, and their 20. You got it. Those doing the squats and the deadlifts. Not only did they improve.
That's fired.
You need a barbell, not to wrap yourself in rubber bands, prancing around like a low-budget pole dancer. So to now the functional drones out there who keep saying back squats degrade your running mechanics, the only thing that actually degrades people's running mechanics is listening to you ignorant wankers.
Jeez.
The line is, you want to run faster, jump higher, and get strong as fuck. Stop wasting your time on overcomplicated functional patterns fluff. Instead, sprint fast, jump often, but also lift some damn heavy weight, and you'll start to see results. Because strength training isn't the problem, it's the solution. No matter what a shirtless sociopath man syndrome says.
My gosh, dude, he lays it out. Okay, so just for a little bit of structure here, Naughty, I mean, I guess we probably should have pulled up a video of him kind of showing his stuff if you're not familiar with his stuff. But he, you know, those cable machines that you do like flies on or like tricep extensions, he has kind of like a cable machine, which he will do a press and a twist, and all of his stuff is rotational. And his claim is basically that in the body, we don't move in the sagittal plane ever. Everything is rotational. And there is some degree of truth, like nobody's actually perfectly symmetrical. There's always going to be some degree of rotation. Yes, in sports, there's also some degree of changing direction and rotation involved. But he takes it to the extreme and he's like, you should never move in the purely sagittal plane, like doing squats and deadlifts, because that's just straight up and down. So anyways, take it from here, Nick. I just want to add that in first.
So Naughty and I have had some words.
Oh, I forgot.
But also Naughty just fights with everybody that isn't his minion.
Correct.
He fights with David Weck, who he stole his stuff.
He did.
And David Weck and I have had some words because both of them are like I think they were conceived in a threesome, both of them, like mom, dad, and Tylenol. Like they have good ideas, but they are very dogmatic and dismissive of everything that isn't like twirling a rope around or balancing on a Bosu ball, or like if you're not FP, you're not me. Yeah. And Meekins is more in like the Ripito camp of like get stronger before you do other stuff, and getting stronger is going to make you better. And I've looked at the literature because I'm a running nerd. Like I've taken hundreds of hours of certification courses on running injury prevention, running gait analysis, and you can't find one article to show that strength training in any form improves running form. But it does prevent injuries.
Yeah.
And
Sense.
you're going to jump higher, like you're going to run faster because you're stronger. Like I have a decal on my wall in my office that says weak things break. Like
Yeah.
Mark Ripito has a quote, stronger people are harder to kill and they're generally more useful. So I'm a big
True.
like strength is like the size of your camper that you take camping. If you're weak, you camp out of the smart car. If you're strong, you get to take the fifth wheel and bring all the cool stuff.
Yeah.
And you have a bigger buffer for like you just have a bigger savings account when like catastrophes and emergencies strike. So strength is never the problem. It's always a solution, to borrow from Mark Bell.
I was about to talk
But
about Mark Bell actually, because he kind of did a little naughty stuff for a while, didn't he? Kind of dabble. But sorry,
he's dabbled with all that stuff. Like I've
yeah,
dabbled with all the supplements,
yeah,
but like I I like to keep an open mind because you and I have been practicing long enough to where we all had multiple beliefs where we were just digging our heels in and we believed it. And when new research comes out, like as scientists, like we're doctors, but we're scientists.
yeah.
Like scientists are reverse confirmation bias people.
Mm,
Like we try to poke holes in our preconceived opinions.
mm-hmm.
Like probably half the stuff that I believed when I graduated, I don't believe anymore. I believe the exact opposite because
100%.
there's been enough high quality studies, high powered studies to refute that.
Right.
And but if you have a following, it's almost like a sunken cost fallacy. Like you can't change your mind because you have this
Right.
following. And you can't change your mind because you have all these people that are parroting your message.
Mm-hmm.
And it just gets you locked into where you put blinders on and you aren't open-minded about like whether somebody could be helped by something outside of your dogmatic skill set.
100%.
And that's what bothers me. Like outside of like both of these guys having rather prickly personalities,
Yeah.
but like I can have that at times, but I'm open-minded. Like it's like if we want to have a discussion, we'll have a discussion. Like half the people I interviewed on my previous podcast were people that I didn't agree with because I wanted to see how they got there.
Yeah.
And like the fact that these two are fighting, it just like cracks me up. I'd say if you put me on the continuum, I would agree a lot more with Meekins than Naughty.
Same.
I don't think the WEC and functional pattern stuff is like dangerous for patients, but I think the claims are wildly exaggerated.
Yeah.
And it's almost like you get someone who eats a terrible diet and they go vegan and they watch Game Changers and they think everybody needs to eat a vegan diet.
Right.
It's like, yeah, it's better than the raccoon diet you were eating.
Exactly.
And you feel so much better. But if you ate a paleo diet, you would be parroting the same thing.
Yeah.
It's like you get a bunch of people that are in a lot of pain and you get them moving with a high quality. Just like you get someone eating processed foods, you get them eating real food. They're going to think whatever plan you put them on is the plan that everybody needs to do.
It goes, it's the same with our last thing with Frozen Shoulder. Like, so one of the other things, it depends upon the person. If you haven't, I'll put up some videos here as we're watching and hopefully in editing that will show some of Naughty's stuff if you're not familiar with it. But he definitely did steal from WEC, and he definitely has kind of taken it to the limit. Like we talked about this in the last episode. Thoracic rotation is one of like the most important things to do. And so we're not saying that rotation is bad. It's helped so many people, so many of our patients over the years. Just it doesn't even need I don't need science for that. I have years of experience of just seeing that people that can rotate through their spine a little bit better makes a lot of things get better. Now, Naughty, honestly, I don't even know if you could prove that they have improved thoracic rotation because they're just rotating anything, anywhere, all the time. Like it's just really pushed it to the limit. And that's how his personality is. And also, that's how the internet works. Like, your people are looking for novelty. They're like, oh, I've never seen that before. What is that? You've got my attention, right? Okay, great. Is it valid? No, because it grabbed your attention does not make it valid. Like that first video on nutrients, like obviously he's hilarious. It got my attention. It was funny. None of it meant anything, right? So
Yeah.
just because it looks novel doesn't make it good. That said, bang for your buck. If you improve your squat and you improve your deadlift, weak people get killed faster. It's there's really nothing harder about it. It's not complicated. And I understand if you have been training for a while that you are an athlete that you would want to look for some sort of novelty in your training. Training can get boring. We're talking to a guy right now who's run 9+ 100-mile races right now. Like, running is like, well, that's, I don't know, you're mentally stronger than 99% of the world to have to do that, but like running can get boring, exercising can get boring. So to want to switch your exercise up, I get it. There's nothing wrong with that. You can do some twisty stuff. However, the bulk of what you need is what Meekins is talking about. You get strong, live long. Like, I don't know, I don't have much else to say.
And if like I view like naughty almost like a supplement. If you want a good, healthy diet that is going to help 99% of people, where you may need some supplements to fill minor voids based on your unique day to day demands, check out Dan John.
Oh yeah, he's great.
Like, I don't normally trust people with two first names, but he's one of the only ones. And like, he's like, yeah, it doesn't have to be hard. Like, you do push, pull, hinge, squat, weighted carry. And he trains sprinters, javelin throwers, discus throwers. So you have sagittal plane and rotational plane athletes. And he threw at a very high level. He's been through all the trends of like Nautilus, aerobics. Like, he's been in the game for a long time.
He's a legend.
And if you ask him like diet, he's like, all right, drink some water, get some fiber, eat the rainbow of vegetables and fruit.
Yeah.
And just don't eat too much like a slob. Eat like an adult. You don't need a toy with your meal. Like, just eat real food. Like, he's just a no BS, like old school. And what I like about him is he is not very inflammatory. He's just like your grandpa, like where he's telling you a story. And so he's not mean.
Yeah.
He's not like where his tongue isn't going to cut holes in you and bleed you out. And he's open-minded because he's seen all the trends.
Yeah.
And he's seen the things that have like stood the test of time. So that's how I program my workouts. And it's like, all right, like that's helped me not get hurt very much and do some of this crazy stuff to where my 3 times a week strength training is push, pull, hinge, squat, weighted carry. It doesn't
Perfect,
have
yeah.
to be hard. And he's got a park bench workout like application on his website where you punch in, all right, how many days a week do you want to train? What do you have in your home gym? And he will build you a balanced workout with an AI algorithm. It's like, all right, I got 3 kettlebells of this weight. I got a jump rope. I got a box. I've got a med ball. I've got a weighted vest. And he'll build you a workout. But he's just big on like, eat like an adult, drink some water, get some fiber, do the 5 big things, and get your steps in and get some walking in.
I had such a big Dan John phase. I would consider myself a Dan John fellow. I've read the books. I know his stupid jokes. Like I found him through kettlebells because he has a DVD of like how to like do a proper swing. Like what it's like to do it. I think he was credited for inventing the goblet squat. Like, bro, you invented the goblet squat. The guy's a G. He's easily one of the safest, um, best recommendations if you're just looking for quality health and strength. Okay, so this is not necessarily quality health and strength. We're going to finish on this one. Thank you guys for listening, but there is a little twist in this one. Just watch and we'll explain it here in a sec.
Stop with all the waist trainer. Stop with all the crunches. This one habit I've been implementing for the past 5 months has literally snatched my waist. Try this out. It all comes down to controlling your core. I like to do stomach vacuums in the morning when I'm fasted, when I don't have tons of food in me, so it's a lot easier. Do about 2 to 3 sets to failure every single day. You want to exhale all your air out, and you're going to pull as high as you can up into your rib cage. So instead of doing 100 crunches a day, this right here can literally strengthen your core way better than your ab crunches. Stop with all the waist training.
Okay, so here's the deal.
This one habit.
The claim is that it will strengthen your core more than ab crunches. Then he goes to say at one point, this has snatched my waist more than anything else. So, first of all, you need to know that there are plenty of studies. Go look up Brett Contreras about spot reducing fat. It's not a thing. Secondly, in terms of like, you can't say, I want to reduce fat in my love handle areas, therefore I'm going to do obliques. It's not how your body works. There's plenty of science that says that's just not how it works. I understand that, the way if you want to get wider, lift wider. I understand stuff like that, right? Like, if you want to run faster, run faster. Like, I understand things like that. But the idea that this will strengthen your core is a misunderstanding of what the core is. It's very possible that this guy felt his core was stronger after this. He's clearly built. And maybe this was one element that he hasn't trained. We can explain why he might feel the benefit of that. Like, you need to understand the level that a guy with pecs and delts like this is at, why he might be like, quit everything else and just do this. This guy has tried everything else. He's gone through the litany of core stuff. And so maybe he has just done this vacuum exercise, which is a classic bodybuilding thing for their poses, right? It's not. Anyway, I'm done. It's not. Don't do this. It's not going to make your core stronger. And I'll go back on. We did a post earlier this week or a couple weeks ago. I say we, I mean me, about what the core is. The core is not a prime mover. The core is mainly to transfer force from the upper body to lower body to upper body. It is an absorber. It is kind of a stabilizer. So anyways, Will can get more into it. I'm curious what you think about this, Nick.
Like, I see so many dysfunctional breathing patterns from people that don't do it to this extreme.
Yeah.
But like, I don't see many dysfunctional breathing patterns in people that are a little chubby because they don't care about sticking their gut out because it's already there.
Yeah.
But you get people that have been over cued to like contract their core, or people that are fit and they don't want to stick their belly out. And that just blocks the diaphragm from getting expansion. You have gut motility issues. You get hiatal hernias. You get all this other stuff that's a problem. It's like, yeah, like you could have a strong core, but you're going to have fucking heartburn every day.
Yeah.
Like it's not correct. Or you're going to have neck pain every day because you can't, like if you got like a brick wall of like you're drawing in, like the air can't go in the basement. So it's going to get apically drawn up with all your accessory muscles. And if you make 22,000 mistakes a day, that's going to be a problem.
Dude, I remember trying this a couple of years ago, and I do remember now I had headaches for a couple days after like practicing. So I was like, forget this. This is not worth it. Because he's like drawing.
One other thing.
Yeah. Go ahead.
Like one other thing, like when people talk to me about like spot fat reduction, I was like, all right, have you ever been to the beach? And they're like, yeah. I'm like, have you ever like had one of those little sand pails? And they're like, yeah. I'm like, take that for the kids all the time. I'm like, all right, if you go get a bucket of water out of the ocean, does it reduce the level of the ocean in that exact spot that you took the water out? And they're like, no. I go, yeah, that's how fat loss works.
Yeah. That's really good. That's good. I think that's the best way to end it. There's some weird stuff on the internet. There's some good stuff on the internet. We thank you guys so much for listening, and look forward to hearing back from you, and see you next week. Thank you, and peace.